Is this going to be a long shutdown?
I don't know, but I actually don't think it's going to be that long of a shutdown.
It's day 5, so let's start there with Arizona's Democratic Senator Mark Kelly. Thank you for being here, joining us in studio on the Sunday briefing.
It's good to be here.
You heard the vice president. He does not think this is going to be a long shutdown. What do you think?
Well, I thought he said he didn't know. I think it's hard to say. I will say this, though. I mean, this comes down to one thing. This is about the price that Americans have to pay for their health care. So it could be easily fixed. I mean, we could sort this out, next week sometime, or even as early as Monday, if Mike Johnson would bring back the Republican House. We get together and have a real negotiation, a bipartisan negotiation, about how to bring down these high costs for the American people.
As I understand it, the House has already passed the spending bill. That's why the White House is appealing to some moderate Democrats to vote with Republicans to reopen the government. You're a moderate Democrat. Are you going to vote with Republicans to reopen the government?
Well, if we could reopen the government and bring down these costs, absolutely. Nobody wants to see the government shut down. I mean, we know what happens when people don't get their paychecks. We get that. But let me tell you a quick story about a woman in Arizona in Prescott. Her name's Robin. I spoke to her last week. She's on a fixed income. She's 60 years old. She's a fifth-generation American. She said to me, she says, why are they making this about immigrants? This isn't about immigrants. This is about me. Now, she pays $250 a month on the ACA, on the exchange, for her health care. But she gets around $9,000 in those premium tax credits. She is expecting, if we do not act on this, that is going to go away. And she says she will not be able to afford health care anymore. So this, Peter, this is about real people who are going to see the price of health care skyrocket.
And you're talking about the price of health care and immigrants. The heart of the disagreement seems to be that Republicans do not think that illegal immigrants should have access to taxpayer-funded health insurance.
And they don't.
So the Democratic position, your official position here, is that illegal immigrants should not have any access to taxpayer-funded health insurance. Does that include federal and state?
Well, the federal law is that undocumented individuals do not have access to Medicare, Medicaid, food stamps, even the Affordable Care Act. That's the law. So this is a red herring from my Republican colleagues. They don't want to, help folks out because they needed that money. And this should be pretty simple for people to understand. When they gave that extension of the 2017 tax cuts, which helped out the richest Americans, it was partially paid for by taking away Medicaid and taking away these ACA tax credits for people who just can't afford health care.
What cards do the Democrats have right now?
Well, I don't want to, equate this to like a game. This is not a game. This is very serious. We've got folks that aren't able to go to work right now, but on November 1st, individuals are going to get these letters if they haven't received them already. Some have. There are folks in Alaska who have received letters that their premiums are going to go up from $600 a month to $4,000 a month. That's unaffordable. And in my state, in Arizona, 109,000 people are likely to lose their health care, meaning that they are one accident or one illness away from bankruptcy.
And I get that the official line is that you have to hold the line to help working class people save money on health care in a few months. But isn't the shutdown hurting working class people right now?
This shutdown hurts government employees and contractors. We all get that. I understand. I served in the United States Navy for 25 years. I've sort of experienced this. Sometimes if you're, in a critical position, it's not going to affect you. But we understand that this has an impact. But when you consider millions of people possibly losing their health care or going bankrupt, when people lose their health care, they die. I mean, that is the reality of this situation we're in. And all we have to do is negotiate it. Now, the majority leader in the Senate, John Thune, talks about, well, we'll have conversations. We need more than conversations. We need a real negotiation. The president met with the 4 leaders of Congress about a week ago on Monday. And it didn't even seem, the feedback we got, it didn't even seem that he understood what these premium tax credits were. So the first step here is the president has to understand what's going on. And when you look around the country and you see who this affects the most, it's folks in rural areas. He won rural parts of this country in almost every state. So this affects his voters, and it should never be about that. I mean, I get that, but I think we both know that, this president pays a close attention to his base. This is going to impact them significantly.
And you mentioned your service, 25 years in the U.S. Navy. We talked a little bit with the with the Secretary of War, excuse me.
You could say defense. It's fine with me.
About the impact that this shutdown is having on active duty service members. Let's listen to this.
Pretty soon they're going to start looking at leaders, looking at Democrats, saying, how long are you going to hold out? Because pretty soon I won't have a paycheck. Chuck Schumer's doing this to protect his own base because he wants to keep his position. It's nonsense.
It's not nonsense. I mean, this is about millions of Americans who are on the verge. On January 1st, these premiums go up. They're finding out about it already. They're going to get letters, and they have to pick a health care plan. How does somebody like Robin, the woman I mentioned, how does she go from paying $250 a month to an additional $9,000 a year on a fixed income? Those people are all over the country. And I mean, my Republican colleagues, I've talked to them, many of them, about this. They understand that this is a real problem affecting the people they represent, and it's solvable. I mean, we know how to solve it. The president could work with Thune and Mike Johnson and say, hey, we're going to get together, we're going to extend these tax credits for 2 or 4 years, and then we're going to come up with a better plan.
And the last thing, I would kick myself if I didn't ask you about this. Vice President Harris wrote in her book, she did not choose Senator Mark Kelly of Arizona as running mate because she feared what the brutalities of a modern political campaign would do to someone she regarded as an American ideal of selfless service. She added, I couldn't afford to test Mark Kelly in that ugly grinder.
The grinder.
How would you have done in the ugly grinder?
Well, I've 39 combat missions, but Peter, it's not about me. I mean, now, that election's in the past. We got to focus on what is this country going to look like in 20, 30, 40 years from now. I'm working on a lot of issues, big issues. How do we rebuild our merchant marine? How do we address AI and pending job loss from that and utility rates going up? We need to build infrastructure. We need to have a plan to retrain people to jobs that might not even exist now. Or if they're mid-career and they lose their job, what are they going to do next to support their family? Those are the things that I'm looking at addressing, and we are working on. I mean, we're working, Todd Young and I on the Merchant Marine. I'm finding colleagues on the other side of the aisle to address the AI issues. That's where the focus needs to be.
Senator Mark Kelly, our first in-studio lawmaker of the new show. Thank you very much.
Happy
for being
to be here.
All right.
I'll come back.
That's good.
Thank you.
See you next week then.
Thanks.
All right.
Click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis. You won't get it anywhere else.